Hey, welcome to the Simple Nutrition Podcast, a show that helps you learn practical and actual nutrition tips from an expert. I am your host, Leonila Campos, a registered dietitian with over 8 years of experience in the nutrition field. Hey, welcome back to another episode in the Simple Nutrition Podcast. I am your host, Leonila Campos, registered dietitian, and today I am so excited to have Dr. Kaushik to talk about constipation with me and talk about pelvic floor health. And so I'm really excited to have her here with me today. And so let's get started. Dr. Kaushik, I'll let you introduce yourself and let you introduce Restore Therapeutics, and then we'll jump into the questions.
So, hi, my name is Akemi Kaushik. I am a doctor of physical therapy. Me and Dr. Yelda Mendoza, we are two providers here in the Central Valley, and we decided to open our own practice. The name of our clinic is Restore Therapeutics Physical Therapy, and we are located in Fresno. We specialize in pelvic health, and we specialize in women's pelvic health, to be more specific. The reason we started our own practice because we saw that we both come from a medical background where we work in the hospital and have worked in the hospital for like over a decade now. So we have realized that how Central Valley lacks a lot of resources. One of them is if a woman is facing any kind of pelvic floor dysfunction, a lot of our patients would tell us that they'll have to travel either to different parts of California to just be seen by a pelvic floor specialist. So that's when the whole need of having providers that are specifically doing this in the Central Valley would probably help more women out. And that's when, we thought of having our own practice here in Fresno.
Yeah, awesome. Thank you for that. And just as we know, right, with any specialty, the wait list could be months and months to be able to see a specialist, especially if you have to go like so far, right? And so having something like this in town, right, or nearby, at least not like in LA or San Francisco, it's a huge help for the community. And we met in a women's business group, and so after we had a conversation, right, learning about our services and our businesses, I learned so much about pelvic floor. I already knew that it is so important to have, a healthy pelvic floor, right, especially as a woman, especially after, having children. But this is your area of expertise. And so can you maybe talk a little bit about how important it is and the huge need for services like this for women specifically that maybe are thinking about having children or they already had children, and how important it is to target that pelvic floor health?
So yeah, thank you for asking that. So a lot of times, people think like pelvic floor dysfunction could only be just linked to somebody just getting older because the minute somebody thinks of pelvic floor dysfunction, they think, oh, when as you get older, you have prolapse. That's something very common that people are aware of. But what people are mostly not aware of is, like you said, you have to take care of your pelvic floor even before you are a mom or you're thinking of being a mom, or you could even have pelvic floor dysfunction as like a teenager. A lot of our we don't do pediatrics, but I know when we were getting our certification and under our training, we learned that a lot of times females, younger females have pelvic floor dysfunction. It could be linked to sexual trauma. There could be multiple factors. And yes, a lot of high level athletes have constipation that nobody talks to them about. And again, constipation can have a lot of other, factors that play a role in, but one of them could be pelvic floor dysfunction. So, and then, prenatal, when you are pregnant, a lot of time people have pelvic floor dysfunction, and you are more, how I should say, you should be more aware of. A lot of times, females think that, now I'm supposed to have my baby, so I should just be relaxing my pelvic floor. So they forget about strengthening, and that can lead to like really poor outcomes after vaginal delivery. So coming to see us can actually help you, maybe help you find some answers, maybe educate you. It's like whatever answer you're looking for, we probably have something that we can educate you and make you aware of, kind of a deal,
Yeah,
if
thank
that
you.
makes sense.
Absolutely. No,
Mhm.
I think the education is huge because, I have two children, and during, the prenatal visits and even the postpartum visits, as I'm educated, right? And nobody talked to me about, how's your pelvic floor? Do you have any issues with constipation, or do you
Mhm.
have any issues with you're not incontinence? Nothing like that. There was never, like, that topic never came up.
Never
And
came
so,
up. Yeah.
what you don't know, but still you can still have these issues, right? And you're like, I guess that's what it is, right? I'm a woman, I had a baby, and I guess this is how it has to be. But that's not it. That's not the case, right?
Yes, that's not an answer. No, that's not a good answer. And like you said, not a lot of time people or even the healthcare providers are asking that those kind of questions. They will tell you that when you're pregnant, you are at high risk of having hemorrhoids, but they never explain to you why. Or it's the same thing after you have had whatever kind of surgery. It could be just simple surgery. People are still, at risk of having hemorrhoids, and it's never explained to them why they. And I think once we explain, as a healthcare professionals, if we do a better job at explaining and educating our patients about the why of it, I think that's when we can see, people are more compliant, and they're more aware, and then they want to find out answers, and then they want to follow through, and at least reduce your risk of having that. I'm not going to say it's going to completely help you out like right away, but at least reduce your risk. I think that's a major thing to do too.
Right. Yeah, absolutely. The education part of it and the why, right? I think a lot of the
Mm-hmm.
times we don't, there's not that, not, there is not that focus on, like, why is it that this is happening, right? And what can I
Right.
do about it? And giving some positivity to it. So since we're on this topic, right, I think now we can segue into how constipation is linked to maybe pelvic floor dysfunction, and maybe yeah, giving like the symptoms if there are any, or how will you identify that, like, in your patients?
Mm-hmm. So that's a good question. I'll give you a little funny story on this. Whenever we see our patients on our intake forms, we have these questionnaire that we have. We highly encourage our patients to like go through and fill them out before they come see us. And on one of those questionnaires, we have a question where it asks, how many times do you have BM a week? And a lot of times people will just check mark and say, I don't have constipation. But then when you're going along the questionnaire, it asks how many, again, like I said, how many BMs do you have in a week? And they'll say, oh, once a week. And when they come to see us, we try to bring this, because a lot of times this topic can be very touchy to individuals. And um, again, like I always say to our patient, at our practice, we offer a very safe space for all our patients to talk about the things that they want to talk about. So, once we establish that, we ask them and we kind of understand, why do they think they don't have constipation when they're only having a BM once a week? And, more than often when you hear their answer, you're like, oh, wow, because somewhere along, somebody said, oh, having BM once a week is okay, as long as you're not going twice, you're not, not being able to empty yourself, every 2 weeks is fine. And I'm like, oh my gosh, this is like, we need to sit down and have a real good conversation. So going back to your question, how do we define constipation? So as per the NIH, the having at least or having less than 3 bowel movements a week is considered constipation. And if your bowels are looking hard, dry, and lumpy. And this goes for adults, kids, older adults, all humankind, I would say. If that's the case, we can say that you fall into the category of having constipation. If also you are having lumpy stools for more than or approximate 25% of your bowel movements are lumpy stools, that's when you have constipation. Or if you have a sensation of being able to not completely empty yourself, majority of like 25% of the time, that's when you can say, I have constipation. Sometimes our patients would say, I don't have problem emptying myself, but I still feel like there's some obstruction I feel when I'm trying to have a bowel movement. That's when you can say you have constipation too. And then, if you're having a bowel movement and you have to strain about 25% of the time, that's again when we say you have constipation. So this is something I would say, this is like the basic definition of constipation. That's used by all the healthcare professionals generally talking about it. And then constipation could be different types. I don't know if you want me to, go through the whole explanation of what are the types of constipation, but I'll be more than happy to.
Yeah, thank you. I think that is great because a lot of the times we just like constipation is just like one thing, right? But no, that would be wonderful to provide that education.
Okay, all right. So constipation. There is a primary kind of constipation which is called idiopathic constipation. That could be divided into three different type of constipation. One is a normal transit constipation. Other one is slow transit constipation, and then the third one is pelvic floor dysfunction. So with pelvic floor dysfunction kind of constipation, that's when people like me and Dr. Mendoza, we come in and we kind of help you out if you have troubles with it. So when you go see your primary or your doctor and then they tell you that you have constipation and probably the cause of your constipation is some kind of pelvic floor dysfunction, you can come and see us and we can help you identify what your causes could be. So generally speaking, when a large intestine, which most of the people call colon, has problems with, we call it peristalsis, which is actually a movement that helps move your waste out of your body. When people have trouble with that, that's what general constipation looks like. And then various factors can go into account into why somebody has constipation. It could be related to your dietary habits, and then that's when our the registered dietitian, she's going to talk to you about. That's outside my scope of practice, so that's something she can definitely in depth explain to you guys. But so one could be dietary things that you might be taking in that could cause constipation, dietary or even imbalance in your diet, like having too much sugar maybe. And again, I'll let her talk about that. But another one could be sedentary life, like if you're sitting at your desk for 8 hours not staying hydrated, that's also one of the cause for constipation. Sometimes lifestyle changes, say for example when we are traveling a lot, we're not staying hydrated, we are not moving, we're not exercising, that can cause constipation too. A lot of times hormonal changes, especially we see this in women a lot when when they are pregnant, they have constipation issues, and right after they deliver baby is when they have constipation too, and that could be also linked to taking certain kind of medication. Now research have over and over shown this: if you're on certain kind of medications, especially painkillers, that can cause major constipation, chronic constipation issues in us. And then, there could be medical causes of constipation, which could be irritable bowel syndrome, which we also call as sluggish colon. And then a lot of people rely on laxatives a lot. So improper use of laxative, believe it or not, can also cause chronic constipation. And then, like I said, so there was general constipation that I spoke about. And then there's another kind of constipation, which is called outlet constipation, which means when your stool is stuck in the rectum, And you would say, why would the stool be stuck in the rectum? That is because of the dysfunction of your pelvic floor muscles. So if your pelvic floor muscles in the rectum area, either they are too tight or they are unable to relax, it becomes very difficult for the stool to pass through. And because over and over again, because people with this kind of problem have difficulty emptying themselves or feel like obstruction or blockage that I spoke about, they often try to strain their pelvic floor muscles just to have that bowel movement. And now what happens is, over the period of just straining these muscles over and over again, leads to weakening of the pelvic floor muscles. And that's why, the topic of the day, how constipation can lead to dysfunction in your pelvic floor, and then can lead to pelvic floor issues, basically incontinence. So constipation and incontinence mostly go hand in hand, and you would see that in children a lot, especially children that are going through the potty training age. They would be good moving around. They would be good controlling their when they have to go pee. But when they have to go poop, it's like they have to take this time out of their playtime and go sit down and poop. So they rather not do that, and that's when you see they have accidents. And a lot of times these patients, or the parents of these patients, would often say, they're potty trained, but I don't understand why they're having these accidents. And the reason is that the number one underlying reason for this is constipation. And it's the exact same thing for older adults or adults with dementia. Like I said, we work in a hospital, and I've seen that a lot. A lot of times our older adults with dementia would not have the bowel movement that they should, and that leads to having incontinence issues during the day a lot of times. So you know the research has done a pretty good job at explaining why this, and hopefully I did a good job at explaining to you guys today how these two can be linked.
Yeah, no, oh my goodness, that's a lot of information that is so valuable, right? One, knowing the different types of constipation. And I think it's really important for patients, if they're having these issues with constipation or not being able to empty themselves properly, to ask the doctor. And if your doctor doesn't know, like, oh yeah, it's constipation, right? But probing more, like, what kind of constipation do I have? Like, is this more of because of a pelvic floor dysfunction? And what can I do about it? Right? Because it's not just like, oh, it's just constipation, right? Or I'm not using the restroom.
Mm-hmm.
Like you said, I'm using the restroom once a week. Yes, that's not normal, right? If you're not eating, that
Mm-hmm.
most, yeah, maybe, but we're eating 3 times a day, 2 times, whatever the amount we're eating. So there's waste that we have to get rid of.
Exactly.
I think that is really important. I do want to go back and talk about the nutrition aspect of constipation, because it is also so important, right? As you briefly mentioned, the fiber. And so fiber is so important to help form those bowel movements, right? BMs, bowel movements, because
Mm-hmm.
that is, when we think about fiber, it's almost like a sponge, right? There's two types: soluble fiber and insoluble fiber, and both have benefits. One that helps with, like, absorb cholesterol and regulate blood sugars, and the other one is to provide bulk, right, for the bowel movements and clean the intestines and help get the bowel movements going. But along those lines, right, well, let me back up a little bit. Fiber, you only get fiber from your plant sources, right? If you're not adding any plant sources to your diet, um, and you're constipated, right, you can start there and see if that helps. So adding different plant sources, your fruits, your vegetables, your whole grains, your nuts and your seeds. I have patients that tell me, can I just have a fiber supplement? If that is the first line of intervention and that's going to get you to get some fiber in, that's fine. Let's do that. But food first, right? We want to be able to add fiber sources, plant sources coming from food first, because you're not only getting fiber, right? You're getting other nutrients, you're getting antioxidants, you're getting phytochemicals, you're getting, some of your carbohydrates. And so we want healthy fats from your nuts and your seeds. So adding food first would be the first intervention. And also because fiber supplements don't have the same amount of fiber that you would want or that you would get from food, right? You almost have to get like 3 capsules or 3 pills to get 5 grams of fiber, right? When we can have half a cup of beans and get like 10 grams of fiber. So food usually is the first line of intervention. But with that, we also have to add the water, right? We want to be able to also add enough water throughout the day um, to help with those bowel movements too, right? It's not just, oh, let's just add a bunch of fiber and now let's not have water, right? Because that can also cause some issues on bloating, could also cause more constipation. So we want to be able to have that balance too. Now, that's from the nutrition aspect, right? Now, let's say with my patients, if we don't see a change, right? Meaning, in the recommendation for fiber is 25 grams of fiber a day for women, 30 grams of fiber for men. So if we're making sure that we're eating that amount of fiber, sometimes maybe a little bit more, we're hydrated, um, and we don't see any changes, right? Then we have to look into more of the dysfunction, right? In my case, I would like refer them. Like, let's figure out why is it that even though we're doing these interventions, like there are things that are not going, and we should be able to see some change. And so I think um, that is so important, right? Knowing that if there's a dysfunction, as a dietitian, I can address that, right? That's way out of my scope of practice. I wouldn't even know what to do. So let's say if we have a patient that has pelvic floor dysfunction, like what are the steps or what are the interventions on your end that you can do for patients to be able to see maybe some improvement with constipation?
Yeah, first of all, I have to say that, when you said that, having enough fiber in your diet is very important, and you said, drinking water is also another very important thing. I just would like to add, a lot of times our patients would say, "No, I hydrate a lot. I drink, you know, Pepsi all day long." And we are trying to explain this to them that, Pepsi actually, does not hydrate your body. It actually throws extra water out of your body because it has so much sodium in it. So, while you were talking about water, I was actually, gulping some water myself.
Right? Yeah, that's a good point there.
But yeah, just to answer your question, so if you do see patients, you've acknowledged the dietary factor, and that could be a cause of their constipation, and they're doing what you've told them to do, but it's still not getting better. I would say the first step they should take is, one, to go see their primary care doctor. They might need to go see a specialist, and there are certain kind of tests they can do to really figure out if the problem is more than just adding fiber to their diet, or just staying active, or hydration. And there are different kind of diagnostic tests that they can run at a doctor's office that I am not going to talk about right now. But once they go do that, and they find out that they do have, like we spoke about, pelvic floor dysfunction, where the muscles are not really coordinating exactly, relaxing and contracting at the time they should, to be able to completely empty out. That's when they, somebody like me or Dr. Mendoza can actually help them. So usually when somebody like that comes to our office, they usually have a doctor's referral, explaining to us what their diagnostic factor is that's causing them to have constipation. Um, again, we start with patient education. Back and forth, we try to work with a registered dietitian that can give them still some good information about what to do with their diet. Also, everybody is now, most of us have heard about a squatty potty and why that's important. I'll just, roughly touch bases today on that. So, one is when you go sit down on a toilet. So Western toilets are designed in a way it's great for comfort, but not really great when it comes to being able to empty yourself out completely. So the best way you should be able to completely empty out yourself is when your knees, basically when you're sitting down and when your knees are higher than your hips. So basically when you put that little footstool right under your toilet seat, when you're sitting down, where your feet are, resting on that little footstool, that should usually position your knees above your hips, and that usually creates that little pelvic tilt that's required for your colon and your rectum to actually, so for like the gravity to actually help with emptying that the feces out. So that's one thing. And another thing is, a lot of times people, and I've been there. When I travel, there are other things that I've been prioritizing other than just going sitting on the toilet, to have a BM. So it's a research fact that once you're awake in the morning, your bowels takes about 30 minutes to be fully awake too. So if you give yourself about that extra 30 minutes in the morning, and you have something warm to drink, and you move around, just slight gentle movements, that should help you with the bowel movements. And again, using a little squatty potty, sitting down with your knees above your hips and your elbows rested on your knees, and really coordinating breathing in and out, and just those little pelvic tilts should actually help you have a better, I should say, better bowel movement, a better experience of having a bowel movement, and not have trouble with like properly emptying yourself out. So having that routine in the morning is also very important. And then, like we said, if they have something structural that's going on with them, we can, again, sometimes not having enough hip mobility, in like range of motion in their joints, can also cause them to have problems with constipation. So we work on, with different kind of exercises, helping on their pelvis, helping their hip to get that better range of motion. We have something called biofeedback that we can use to help patients, and there's a lot of research out there that actually explain and really prove that biofeedback has really helped a lot of people with chronic constipation to be able to, again, have that good bowel movement and be able to completely empty their bowels out. We can also teach them how to self-massage, which actually has, if you do the same thing to a little kid that's having a lot of bloating, helps them a lot. And we and I personally have used this technique for some of my patients when I worked at the hospital. We would give them little abdominal massage, and there's a whole technique on this. And once I need to see you in person to teach you exactly what to do, but once you do that, you can literally see how that kind of helps your bowels to move, basically that peristalsis movement that we were talking about. And then again, if your cause is tightness in the pelvic floor muscles, we can work on relaxing those pelvic floor muscles. That's when the biofeedback comes in. Or if your problem is weakness in the pelvic floor because of chronic straining those muscles to have a bowel movement, then we can work on strengthening those pelvic floor muscles. So there could be all these kind of different routes that we can take to like really help you out with that chronic constipation.
Yeah, that is amazing that there is hope there, right? Like there's no like, oh, this is what it is. But I think it's so
Yes.
wonderful that, as professionals like yourself, and then there's a service there, right? That they can reach out to you and just learn how to do those things. Honestly, we have a squatty party that my mother-in-law got for my son when he was little. Um, and it helps him a lot. And so yeah, I didn't know that the whole reasoning behind it. So thank you for explaining that, because I was just like, what is that? Like, it's just lift your legs up or what? So yeah, thank you so much. Like I learned a lot right now. So I'm sure the listeners are going to appreciate that as well. And just knowing that, there are reasons why things happen to our bodies, right? Not just like saying like, oh well, I'm having these problems and it's just like that's what it's going to be. But there's actually a reason and also interventions, right? Things that we can do to improve it, not only from a nutrition aspect, but definitely more of a physical therapy aspect too, right? The structure of it as well.
Mhm.
Um, let's see. Yeah, so we talked about that, of course, and I think this is such a great way to a great segue to talk about your upcoming class, right? It's a series of classes, and I think these classes are going to be wonderful to again provide education. But tell the listeners about your upcoming class series.
So yeah, thank you for asking. So we are really excited. A lot of times, we've received a lot of calls in our office asking, "I don't think I need pelvic. I don't need. I need. I don't think I really need a treatment for pelvic floor dysfunctions. But do you offer any kind of classes that we can come in and maybe see if we might need?" And I think that's why me and Dr. Mendoza, we came up with this idea that, we should probably run like little classes where like it's just a 1 hour class, and we are doing like a series because this is me personally. I think if we just ran one class, I don't think people are able to see exactly what benefits comes out of being a participant in those classes. So that's why we came up with this 6 part series. Basically, we're trying to do this every Saturday 9 to 10. It's a 6 week class. So we can actually educate people, one, and two, for them to really see for themselves the benefits that they can have once they come into the class and they really learn. And believe me, when I say, so I treat patients, and now when this will be my first time doing classes with them. And how some of our participants would come in, our females would come in, and they will say, oh wow, I thought this would be like a class, like a Zumba class or whatever, and I'll be sweating. I'm not sweating, but the inside I can feel it. And that's such a great compliment coming from them, meaning that they thought that this would be just an exercise class, but it's more than that. It's about coordinating your pelvic floor muscles along with coordinating your breathing, and then the whole movement, how your hips, how your core, your hips, your spine, all these things, your rib cage, all these things move together like a block per se. And they're not like separate pieces. So first few classes, what we do is we try to isolate and we try to explain to them what a pelvic floor contraction feels like, because most of our women, I'm sorry to say, but their idea of pelvic floor class is just doing Kegels. And that's not an answer to pelvic floor problems. There's more to just doing Kegels. So the first part of the class is just focusing, isolating those muscles and explaining to them what a contraction and relaxation feels like. And then, we try to engage and coordinate that with the breathing, why breathing is so important. And then, why posture and breathing go hand in hand, so forth and so forth. So this is why we came up with a 6 session class, so people can gain a lot out of those just from having like 2 or 3 classes, and that's it. But yeah, usually we tell our females that if you do this 6 part series and see if you found some benefits and you feel like you still need more, we are here. You can always come back and we can see you at the clinic to focus on the other things that you need to focus on.
Yeah, and those classes are I'm sure you're gonna learn so much as you are learning right now. There's so much to the pelvic floor health, and so and I think we definitely need another interview, another episode to talk about what you mentioned about the posture and how just it's like a block, right? And having that foundation, because you cannot just go out and like, oh, let me do some squats and things like that, that you're not engaging your core properly, then it leads to injuries. And so I think we need an episode on just that alone, because I'm sure it'll take some time too. But yeah, so these classes, please, if you're in town, right, if you're around town, join the classes. You're going to learn so much. And so with that, again, where can the listeners find you? Where can they maybe sign up for the class, or how can they get in contact with you?
So yeah, thank you for asking. Great question. So we post a lot on Instagram about our classes. We already are running the 6-part series right now. If I have enough participants, and again, I forgot to say this. Usually, we are just doing very small group. It's just 5 to 6 women max, and it's just 5 to 6 because we wanted those women to have that one-on-one kind of, so we have hands-on kind of approach to them and make them feel like what we really need them to focus on. So very small group classes. So right now we are running 1-part series where, we started in March and then we are doing it for 6 weeks. If I have enough people that sign up for the class, we can always do another series, which could be like from 10 to 11 or whatnot. But yeah, we definitely, if you want to know more information, we post a lot on Instagram. Our Instagram handle is Restore Therapeutics. And then you can also find us on Google, Restore Therapeutics Physical Therapy. And it will take you to our website. You can click on book now and you'll see different options there. And if you click on six-part pelvic floor or pelvic vitality classes, that's the class you're looking for.
Awesome. Thank you so much. And I'll link all that information in the show notes. So if you're driving or you're busy and you're like, I didn't have time to catch that, just go back to the show notes and you'll find it there. You can follow them on social media, and you can just check out the classes or any other services, any other questions really that you have about what we talked about today, or maybe something that is not related to constipation, but maybe to pelvic floor dysfunction or any other services. Reach out to them and just ask your questions, right? I'm sure, like you said, you get tons of calls. So if there's a burning question that you have, just call and then ask that question. Any final tips, any final information that you would like to give? Anything else that you would like the listeners to know?
So yeah, like you said, there is hope. Never just take one answer as the final answer. If your doctor said surgery is the only option as of right now for any of your pelvic floor dysfunction needs, please, 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 before you take that decision of going for surgery, come see us. We might be able to help you out. Again, not a promise, but at least there is hope. I think it doesn't hurt to try. It doesn't hurt to get a second opinion from a pelvic floor specialist. So yeah, I think for all the women that are listening, or to men, but right now we are only doing, we are specialized clinic for women's health. So all the women's out there that have heard like, oh, this is how it's going to be, and it's not going to get better. It's just going to get worse from here. Please come see us.
Awesome. Thank you. I think that gives a lot of hope, right? Excuse me. And so, reach out to them, and they'll give you, the guidance that you need. They'll give you information that is going to be useful for you. So thank you so much, Dr. Kaushik, for taking this time to do this interview with me. I know we definitely are going to have to schedule another episode to talk more about, the topic of pelvic floor dysfunction and these other topics that we had a chance to talk about. And like, I have so much information that I learned, and I think it's important for the public to also know. But yes, thank you so much for today.
Thank you for having me. Thank you.
No problem. All right, my friends. Well, thank you for joining me in today's episode. Remember to stay safe and stay strong, and I will see you in another episode. All right, bye-bye for now. This podcast, the links and resources provided are for the purpose to educate only and are not a replacement for medical advice or nutrition therapy. I suggest you seek out the help of a trained professional to help you with your specific situation and needs.